Don't forget, we're ending this podcast with a neck adjustment.
Oh, man.
Yeah, I could be the lady. Thing on your mind. We could turn some brothers on the beach coastside.
Did you know that the American Medical Association once tried to bury an entire healing profession, labeling chiropractors as quacks? If that shocks you, it should, because it happened not so long ago. For decades, chiropractic care was dismissed, attacked, and even made illegal in some states. But here's the twist. What the AMA tried to suppress is now one of the most sought-after paths to healing. And science is finally catching up to what patients have known for years. When your spine is aligned, your nervous system can communicate freely. And when your nervous system communicates freely, your organs, your immune system, and even your mood start to function better. That's not woo-woo, you guys. That's biology. And no one knows that better than my guest, Dr. Raffi Gureghian. Dr. Raffi is an expert chiropractor known for his precision, intuition, and a gift for seeing what MRIs often miss. He specializes in full body alignment, advanced cranial adjustment, and precision work for elites, athletes, actors, fighters, and everyday people like you and I. I've known Dr. Raffi for over a decade, and I can tell you, his work isn't just about cracking backs. It's about unlocking the body's potential and releasing tension that's been stored for years, sometimes decades. So today, we're diving deep into the truth and the power of chiropractic care, how it works, why it was once silenced, and why it's making such a big comeback. So let's get to the heart of it with Lily. Okay, Dr. Raffi, welcome to the Heart of It with Lily. Let's dive right in.
All right, let's go.
So I've visited your clinic a bunch of times, and every time I'm sitting in the weight room, I see patients walk out so relieved and glowing and relaxed. Like the adjustment or whatever you did in there isn't just physical, it's an emotional thing. They just seem so relaxed. So you're obviously very passionate about what you do. I guess the first question would be, what drew you to chiropractic? And was there a pivotal moment where you knew, okay, this is the field for me?
First of all, the whole glowing, mental and emotional, I kind of want to give an explanation. So when those pops do happen, there's a gas released in your body, right? Mm-hmm. And it releases a hormone called endorphins. So that's your feeling of euphoria and relaxation. So there is a science to that.
So it's biology.
Yes.
Okay.
How far away do you want me to go? But the reason I'm a chiropractor was because of a car accident I was involved in. Very severe, flew out of the car, very badly injured.
I don't even want to ask who was driving.
I was driving. I was the only
goodness.
one. I ended up flying out of the passenger seat window. Anyways, I was a very good soccer player, very high up in the leagues here in Coast League in the United States, and wasn't able to walk properly, and I thought my career was over, and I actually was being treated by a chiropractor. Within a few months, he got me back to like pre-accident state. Maybe not going to make like the big leagues in soccer, but I was still able to play. And from that moment on, I knew I always wanted to help people. I loved helping people, and I always wanted to do something in healthcare. So I said, I want to change lives like he changed mine. And from that day forward, I dedicated my life to chiropractic. Yeah.
It seems like a lot of people that get into the medical world have also had similar experiences. Yeah. Speaking of your patients, is there a story of someone who came to you that was really skeptical about chiropractic care that you changed them with, a service or a procedure? Like, is there a specific story that comes to mind?
There's plenty of life-changing stories. Majority of them do come with belief or at least hope, or tried everything else, and chiropractic's like, okay, the last resort. And fortunately, I've created a reputation where, if you're going to a chiropractor, this is the clinic you need to go to.
Yeah.
But one, because of your skepticism, question, I would say is I knew a girl who worked at one of the dealerships. I would take my car into service. During COVID, her youngest brother, at 16 years old, started developing depression symptoms.
Mhm.
Went to the doctor, diagnosed this young poor kid with depression, put him on antidepressants, which he had to do for the rest of his life. She called or texted me and said, "Look, I have no one else to go to. I see your adjustments and like the spinal adjustments that I do. Can you see if you can help him?"
Mhm.
After speaking to him during the history, the exam taking, during COVID, he's young. What does he do? He's in bed all day on his phone or playing video games in a really bad posture. His mid back, which is your thoracic spine, was completely shifted,
It's like a lot of kids
subluxated.
these days.
Yes. So all your emotions are actually stored in the mid back, your thoracic spine, your heart rate, your breathing. Okay, a lot of emotions and stress. Um, we decompressed his spine. I adjusted it, gave him some posture correcting exercises. Within 4 visits, he actually made an appointment to go get a haircut. Within like 6 visits, he
Aw.
started going out with his friends. And less than 10 visits, I never saw him again. But this poor kid, if the sister didn't know
Yeah.
me and
Yeah.
bring him in, and of course he's skeptical, he doesn't know something's going on. This kid was going to be diagnosed and be put on pills for the rest of his life. His whole life was going to be altered in a
Yeah.
different path. So that one I'm very proud of.
That's a good one.
Yeah.
Absolutely. I mean, a lot of people are still skeptics, and we'll get into the whole
Yeah.
MMA nonsense later, but a lot of people are still massively skeptical about chiropractic,
Mhm.
and it's so bizarre to me.
Yeah.
How do you explain to someone who's super skeptical that it's not just cracking a back?
It's tough. And I respect everyone's opinion, okay? But at the end of the day, you should at least try it before making such an assumption. But our bodies are so enhanced and evolved to where it's it's capable of withstanding so much pain, trauma, and it can heal so much naturally, right? All we say, if you have a healthy, balanced diet, sleep, mental and physical health, God forbid, yes, like unspeakable,
Yeah.
like diagnoses, the body can
I mean, I
help
think personally,
anything.
even with
Yeah,
those, your body can heal itself.
I have to agree with you. I just don't want to get too in depth with
Yeah,
that.
that's okay. I'll do that.
But let's say medical MDs and chiropractors, they were invented around the same time, within I think 5 years of each other. MDs, their philosophy is their whole approach is that disease comes from like
Mhm.
bloodborne pathogens. Whereas chiropractic, our focus is everything is based off nerve impingement or lack of nerve function,
Yeah.
which if your brain is sending signals to your gut, your liver, your spine, your fingers, and if something's interrupting that signal, it's like a traffic jam. It's going to interrupt it. So things don't work the way they intend to, and slowly things break down. Other organs or body parts start to compensate, and that's where all this physical
Mm.
posture or um, discomfort start. You could say.
I want to get more detailed into the traffic jam of the spine later, but one of the things that you mentioned is, the chiropractic and the AMA that kind of started within the same time frame.
Mhm.
And it's so wild that the American Medical Association went so hard to discredit chiropractic care, even suing doctors.
Mhm.
I mean, they altered medical books to use the term quackery when referring to chiropractic care.
You
I'm
could say
so
it. Sorry to interrupt. Say it. They were put in jail.
Yeah.
Y-
Oh, I didn't know.
Yeah,
Okay, so tell
they
me
were put
about
in
that.
they were put in jail. So they didn't believe in it. They thought it was like malpractice and disservice, and anyone who was seen practicing chiropractic was actually put in jail. They were
That's
imprisoned,
wild.
yeah, and they didn't care. Those pioneers, DD Palmer, BJ Palmer, um, can you imagine practicing something, but you have to be so passionate in it and believe in it so much that you're willing to go and spend time in jail for who knows
Yeah.
how long and be ridiculed? And like,
It's
I'm so proud
insane.
of them because
Yeah.
like so many people would have given up, but it just shows how powerful their belief and passion was in this craft. So
And in reality, chiropractic care is not new.
no,
The AMA is new, but chiropractic care
Yes.
goes way back to
1895.
so long ago.
Yeah. So the first ever adjustment, I think September 1895. They drilled this one in my head.
Oh my gosh.
Davenport, Iowa. D.D. Palmer. So there was a guy named Harvey Lillard.
Lillard.
So yeah, that was it. Harvey Lillard. That's definitely going to be on the test. Students, future doctors here. So he had a hump in his back, and D.D. Palmer used to like do bone setting. So he's like, oh, let me see what that is. He starts palpating it and then gives it a quick thrust, and that hump just pops back in. And mind you, this guy, Harvey Lillard, was hit by a car at a young age. He lost his hearing. So after he got
Wow.
adjusted, his hearing came back.
Oh
So
my
D.D. Palmer's like, oh my
gosh.
God, what is this? And it ended up, after doing research, we found out it's T4 level, which has like a direct effect on hearing and stuff like that.
Is it like nerve related?
Yes. So everything is nerve. Well,
So
if
I
you
was
ask me, everything is nerve related.
Yeah. I was actually going to ask you, like, the reason that it changed or why the AMA can no longer suppress this amazing modality. I was going to ask, was there a specific study or something that came out that really just set
I
things?
wish I could remember the lawsuit or the court case.
But there was something.
Big time, 60s or 70s. And I'm kind of ashamed that I can't recall it, but it was huge. And the judge actually ruled in our favor. And so much so they were trying to suppress us that they said, whatever you guys want as chiropractors, we will grant it.
Oh, it was so damning that they basically were like, you have
there was
free
so much
reign.
proof of how biased, I guess, or without any proof, they're trying to destroy our credibility, that they allowed us to choose what kind of reward or punishment they could
Free reign.
give to the AMA. And the humble people that we are, we just said we just want to be respected and viewed as equals, even though we could have asked for like so much more say or power in what gets approved, what gets prescribed, and possibly even us being the first referral source before people get
like
put into medication and like, a
It's
more
said that a lot of
serious
people don't
treatment
know
program.
that. But, you mentioned traffic jam earlier. And what I wanted to segue into is, alignment, energy flow. And the spine isn't just bone, right? It's a highway for your nervous system.
Of course.
So connecting your brain to your other organs. Can you explain how misalignment is a traffic jam and how your body's wiring, how it can affect your organs? Like we've talked a lot about the spine and the liver because of, my interest in the liver.
Of course. Well, any organ, right? Anything in the body, we have one and we need to treat it like a temple. So if your brain is extending and then there's a brain stem with cranial nerves, I'll just leave it at that. And I've realized the hardest thing for me once I graduated was taking my deep knowledge and terminology and trying to put it in layman's terms so someone with no knowledge of it can understand.
Like general vernacular?
So the spine protects the spinal cords, and after the second vertebrae, every level has two nerves branching out. Actually, can I grab one of these?
Yeah, go for it.
I just don't want to. Okay, let's just say. So this is more to scale the lumbar spine, but the concept is
for
same.
us newbies. What does that mean? Like,
Lumbar
where is that in the
back.
body?
So lumbar spine is your low back. Okay, so cervical is your neck, thoracic is your mid back, and then you have your lumbar. This is to scale the lumbar spine. These sharp things are actually in the back, the little pointy things right in the middle of the back, okay? So this is already the spinal cord, which is extended from the brain stem, which has your 12 cranial nerves, which are like essential for all your functions and hormone release and everything like that. And then that's connected to your brain. So imagine like a little on-ramp. So the brain connects to an on-ramp to your spinal cord.
Okay.
After the second level of the vertebrae, every level has a left and right nerve branching out. In the neck, it gets woven here, called the plexus. Any movement, sensation has to do with the arms. It's all from the neck. Anything in the mid-back
Which I learned from you a long time ago.
Yes. And I mean,
I was like, what's wrong
still,
with my hands?
and
Did
try
I
telling
twist?
a
You're
patient,
like, it's your neck.
Yeah. And you're like, no, why are you
Which
treating my
neck?
neck? My pain's here, doctor. And that's one of the hardest things to like get a patient to understand. But the thoracic spine then goes along the ribs, and it actually innervates a lot of our organs. So again, heart, breathing, digestion, and then same with lumbar. But the lumbar then connects and becomes the sciatic nerve, which is the biggest nerve in the
Huge
body, size of a hose, and anything to do with the lower extremities, it has to do with, and actually, the sacrum and this S2, 3, 4 has to do with erection. So. Yeah, the sacrum obviously then innervates your pelvic groin regions. So imagine if this is, we said hose, right? Let's just say this nerve is a hose connecting to your liver.
Yeah.
Okay. And I have the water on fully. What happens if I step on the hose or give it a kink? Ooh. That water is not going to flow. Yeah. And if
that
the
area
water
of your
is for a hose,
going to dry up.
But this is a synapse or a nerve impulse. So imagine if this is not sending full power to the liver to do the job it needs to, or digest or break down. And 1 day, 2 days is different. Problem. As we age, it gets slower. So that's where it comes from.
Yeah, I mean, that's such important information, and the way that you explain it, like if that part of your body is misaligned and it's preventing the flow of, let's just say, energy to your liver or kidney, then if it's a garden, that area is going to dry up and it's not going to be functioning well. What is a cranial adjustment?
So,
and aside from just like the physical release, is it also a powerful emotional release?
Big time.
And what do you use to do a cranial adjustment?
Besides emotional, it's the biggest benefit is neurological. Okay. So imagine you've been adjusted by me, by a few chiropractors, okay? Our spine and the nerves I just explained to you, that's only 20% of our nervous system. The other 80% is in our cranium, in our skull, our brain stem, okay? So
like over here?
Yes, so patients leave with a smile and glowing, but that's only because of the 20% I was accessing or adjusting. So there's so much more benefit, and I get it. It's a little difficult to understand or feel comfortable to get performed on you. But once it's done,
if I wasn't a chicken, I'd have you do it right here. But
no worries, we're not going to do it today.
No.
Okay, but if you see this model right here, I call it the blow up or bursting skull. Okay, because all of us assume the skull is immobile. Once it ossifies after a certain age, right? The sutures, which when we're born needs to be soft, correct? So in order for us to
especially the babies
get
right
pushed
here
through the vaginal canal during birth, correct? And this was created over a century ago and was created to treat newborns, which back then forceps and suction cups. This wasn't meant for adults. Which one?
Is that the adjuster?
This?
Yeah.
Yes, this is the adjuster. You want to see it? Or
yeah.
You want me? Okay.
A big thank you to today's sponsor, Dr. Raffi Gureghian of Gureghian Chiropractic. With 2 locations, one in Granada Hills and one in Sherman Oaks, Dr. Raffi goes far beyond the typical crack. He offers precise chiropractic care, advanced cranial adjustment, and a complete nervous system reset that helps your body move, breathe, and function at its best. And at his Granada Hills location, you'll also find age-old therapies like acupuncture, cupping, red light therapy, and a lot more. It's a treasure box of natural healing modalities that work with your body instead of against it. These treatments don't just relieve pain, they restore balance. They're powerful, time-tested, and they come without a long list of side effects that usually follows a prescription bottle. If you're ready to experience deeper healing, visit GureghianChiro.com, call 818-407-0007, or stop by their Granada Hills or Sherman Oaks locations and let them know that Lily sent you.
So
But
when
I didn't know it was started for
the original
newborns.
inventor started this and practiced on babies, and the only reason it didn't get big enough was there was one death only because the baby swallowed it and it got stuck. And this was
wow.
like 100 years ago,
Yeah.
but there was like hundreds of positive findings.
Yeah,
Okay,
thousands, I believe, right?
more.
Yeah.
I'm sure. So what he noticed was because of too much pressure on the skull during birth, the skull would be deformed, and then there would be other types of problems developed in these children. So what he then realized that the skull is still soft and moves. So just like the spine or a wrist, we can align it. And how do we align a skull? So there is your nasal canal. Okay, so we don't go up your nose, we go through your nasal canal, which is pretty much this one. All right. And then there's things called turbinates, which comes from the word turbulence comes for that. Okay, so when we breathe in, it creates like a little turbulence kind of thing to like just clean up everything. So what we do is we put a balloon into that opening, and there's 3 on each side.
Well, how do you get in there?
Take a little toothpick with a flat end and then just guide it in, obviously with some.
But it is through the nose.
It's not up the nose. It's literally through
it goes
the nose.
This way.
But we have specific pillows that get you at an angle where you're completely relaxed.
I mean, I've seen
and
you.
it just
I've
takes
seen
2
it,
seconds.
You do
but
it. They look totally relaxed.
It's just the more scary thing is like the anticipation of what it's going to feel like. And I assure you, it doesn't hurt. It's just pressure.
Yeah.
And the one I get a lot is, sometimes you jump in the pool and you get water in your nose. That's it. But it's over in like 2 seconds. And
okay, now I can't wait to do it.
okay. So what we do is after it goes in, correct? There's space right here. We blow up the balloon. And then what happens, Lil John, after there's enough pressure, it actually adjusts the vomer, the sphenoid, and all those bones.
Everything
and
goes
then
into
everything
place.
starts, and they're all indirectly connected. So even if not the first visit, eventually you do get these adjusted. Most patients that I do see is for sleep apnea and breathing deviated septums, but I do have a very cool case. It is, and that's what they usually come for, but there's so much more benefits. Neurological deficits. 100% of the time this treats Bell's palsy, trigeminal neuralgia.
Which is so bad
My
right now.
My sister had one growing up as well. So, it kind of mimics
Bell's palsy. Lucy had it?
It comes from stress or getting sick, and pretty much it mimics a stroke because half your face, half the side is paralyzed.
It happened to me. I got shingles in my ear, and the doctor said I'm going to be paralyzed forever.
No.
Like my eye one of my eyes
Did
couldn't
you
close.
lose eyebrow hair or no?
No.
Wow.
No, this is another reason why I am careful with doctors. Sorry, guys.
Yeah.
But, I looked up stuff on YouTube how to, and I think I came and I visited you.
Yeah.
And then I did facial exercises and was fine.
Yeah. It might be just inflammation. And again, I feel like sometimes they're just pushing what is going to get them compensated. And especially nowadays, there is like the big scandal of that is probably the case. And it's very sad. And if you want to watch a directory on Netflix, I could send it to you called Doctored. There's a lot of studies where there was a kid, the doctor told him had cancer, had pushed the medication, and then years later found out he didn't have this disease that was diagnosed, and he was only pushing it because he got very handsomely compensated.
This case, and the guy went to jail.
Yeah,
and he did it to hundreds of people.
As he should. That is a disservice and disgusting, honestly.
Well, thankfully, and mind you, there's a lot of amazing physicians out there.
Yes.
You guys don't know, but my dad had liver disease, which I'm going to get into in a different episode. But he did have amazing surgeons at Cedars that performed a miraculous transplant. So everything in its place. But what I'm very excited for is the new ways of healing, regenerative healing, restoration, and flow, and using chiropractic care, and a ton of other modalities that we'll get into on in the next episode. But with cranial adjustments, I know you just went to a huge conference.
Mm-hmm.
There's a lot of other amazing things going on in your industry. Are there any that you want to specifically talk about, or things that you're doing, or a combination? Because I know you do cupping and acupuncture
Yes.
and those things right
Well,
now.
we do cupping as chiropractors, but in the state of California, we can't do the fire one
Yeah.
that you're used to. And hence, we have a doctor of acupuncture.
Yeah.
And I don't want this to seem like I'm bashing MDs. Not at all. They're great.
No,
okay?
everything
Obviously.
has its place.
Just like they have some misunderstandings of us. I wish they could approach their specialty a little differently. Maybe
well, one
a
of
more
your best
holistic-
friends is an MD
getting married tomorrow. And funny you say that. His like second month
I gotta
in
have
med
him on.
school. Oh
He's
my
funny.
dude, but you would love him.
He's funny.
I mean, that's kind of how we met.
Yeah.
At one of their house gatherings, if that's what you would call it. But
Now.
Okay. Where was I?
So like the newest advancements.
So he just got into med school 2 months in, and he calls me. He's like, Raf, they hate you guys.
Wow,
and I was already
still?
no, this was, but he's like, I spoke up. I told him I love it. And I get him. Some chiropractors, they want to do more than they can, like try to take over like
Staying
MD
out of their
stuff, which
lane.
no, stay within your scope.
Yeah.
Okay. And when he said it, I'm like, dude, like the stuff he would say, and literally they would spend like a couple days in school just dedicated to bashing us. But fortunately, more and more MDs are saying, we love what you guys do. We believe in it. We could like
work together.
co-treat, but again, most of their things is just stay within your lane, which absolutely, if I don't have the experience or education or past board exams to diagnose or practice a certain thing, I'm refraining from it.
Yeah. I mean, I don't have any sort of degrees like that. I have a degree in psych, but I don't stay in my lane, as you know. I go into every lane and I wreak havoc because I want to know inside and out, which is one of the reasons why I'm doing the Heart of It with Lily, because I really want to get deep into all of these different modalities.
Okay.
And I'm so excited for the next episode for us to get into it. But with chiropractic, I've seen so many videos, and aside from videos in your office on your Instagram account, was it just yesterday you posted a guy that came in with completely like awkward face?
Yeah.
I mean, we have.
Well, I'm sorry, just like he just looks like that.
No, he didn't look like that after.
He was actually a comedian, but
okay. But you could see even with his exaggeration, he had some like, I don't know what it was. His nerves
it was tilted.
Something was up,
Yes.
and then right after you adjusted him, boom, the guy was symmetrical again.
And you should see the other clips we have. He was in character a little bit, and
hilarious.
He's known for that. Michael Passion, you could tag him, give you a shout out.
We'll obviously put like your Instagram and everything on there, but it's Gureghian chiropractic, the whole thing.
Gureghian chiropractic.
Dog. Okay.
Yeah. So he did not break character for the hour he was there.
He's
but then
funny.
I did an adjustment where I do the Y strap. And he just forgot. You could tell like it was Michael talking, but I feel
when
like
you do that, it's insane. Can you say what it is that you do?
So I don't even want to call it a Y strap because most of the time I don't use the Y strap tool anymore. But
use
it is
towel, right?
It's an axial spinal decompression or adjustment. So we talked kind of briefly about the nerves, but in between every vertebrae, you have this red part. This is the disc, okay? Think of a jelly donut. The disc is actually right in the middle, and then the dough keeps it centered and in place. What is the job of the discs? It absorbs all the shock in our body, lifting, sitting, pushing, any exertion, okay? Through age, trauma, sports, what happens if I push down on a jelly donut? Eventually that jelly through the pressure is going to start piercing the dough and it's going to get flat. If I put enough pressure, the jelly is going to leak out, and that's a disc herniation.
Oh my gosh.
Okay. So
that sounds really painful.
All this comes from compression. So with that axial traction, we are doing the exact opposite. We're decompressing.
Oh, that makes sense. That's why you maybe
opens
I'll share
everything
my
up.
video of when you did it.
You have it?
It was what? Yeah, you guys sent it to me.
Okay.
I was like,
if done right and properly, it is life-changing. Unfortunately, I do see a lot of them performing it way too aggressively, but it just opens everything up. Depends on how restricted you are, especially your breathing. The best results I know are when they start coughing, or sometimes they scream and like go into some panic, and then just
Yeah.
relax, like you said, calm down, because it's just
It's
such
profound.
a rush of endorphins where your body just freaks out, doesn't know what's going on, and it just takes a few seconds to settle in. And another one is, Doc, I'm sweating. Yes, your nerves are finally starting to fire again. Or I got
amazing.
oxygen to the brain. You'll see one of these.
You think clearer.
Yes.
Honestly, everyone needs to go follow your Instagram. You're also
Sure.
on TikTok, because the stuff you guys post is wild.
You should see the stuff we don't post, or I can't because I choose not to. If there's a patient so vulnerable and in severe pain, walking with a cane, or just not in a good state, I'm not going to say, do you mind if I record you? But then within one visit, those patients, or 2 visits, they're like such a different person. And I'm like, I just wish just to show people like what can
I'm
be
sure
done.
they won't even mind, but because you're such a professional, you don't want to.
I don't want it to think.
Which is probably why you haven't shared my wild videos, because.
Well, you first.
Oh my God. I mean, we have a good time, but it is really amazing. I see people while I'm waiting go in like kind of like this, and then they come out. It's like cloud 9, like they just had some crazy psychological therapy, and they're just smiling, and it's really amazing. Which reminds me, I need to bring my mom in, because she's been having vertigo lately. And she went and they did these exercises where you get up and then you turn your head because of the crystals in your ear, which is something I had no idea about. We got crystals in our ear.
Yes.
This is kind of off topic.
Crystals and hairs, by the way. So like when you get ringing in your ears from loud music, you're damaging them. And that's why as we age, we're unable to hear different pitched sounds. So kids can hear certain things that people my age or older probably can't, and vice versa.
Never. We're never going to grow up.
Yes, it's probably the Dix Hall Pike maneuver they were doing, where they had them turn, lay down, get up. But I've had some positive results with that.
Yeah, I'm going to bring my mom. Maybe we'll record it. I got to bring her in.
There was no trauma involved, was there? She just started developing it. Was there an ear infection?
I think emotional trauma, just, for years of watching my dad deal and battle with liver disease. I think it was a lot of emotional trauma, because it's not easy to be around somebody who you absolutely are obsessed with, get to that level, but thank God he's okay.
Did you see him jaundiced? Well, yes, amen. Thank you,
God. I'm going to share on another episode with my sister Lucy. I'll bring her on. I'll share the stuff that we went through and all of the things that we developed and protocols that we developed to save him. And I wrote a book, and I'll share all of that stuff in another episode. But today is about Dr. Raffi and the intuitive.
And I'm glad you got to tell your story that he's still with us. So I'm going to leave it at that. Thank you. But
what I want people to understand, and why I specifically chose to do chiropractic as my very first episode, because for me, I believe at the very core of healing is to have an aligned spine. Because if you have an aligned spine, everything flows really well. Like you were saying, if that's one big hose, and then you have little ones going out to all of your organs, and if you step on that hose, like if your body's misaligned, then your liver is not going to get what it needs, and neither are the other organs. So alignment isn't just about having good posture and vanity.
Exactly.
It's about like really giving your body a fighting chance, especially in this toxic, crazy world that we're living in.
I feel like it's essential if your lifestyle is essential. Okay. If you're trying to live a life of wellness, okay? And people say, I don't want to do chiropractic because I heard once you go, you have to always go. And I said, absolutely. And it's not about going all the time. Well, do you not see a dentist every 6 months? It's the same thing. It's spine health. And I wish we could start as chiropractors, just like how they dentists started promoting dental hygiene, and it completely changed their course of like their industry. It should be promoted. And I tell people, unfortunately, if the spine was a part of our face where you could see it, everyone would go see a chiropractor.
But you know what? It is. It really is.
But they don't know that. Even the skin,
because if your
right?
spine is not working properly, your skin looks terrible.
Yeah.
You look
You
terrible.
don't
Your
sleep
facial
properly.
expressions are
Your
terrible.
blood
You don't,
pressure, Lily.
your blood, I mean, everything.
Yes.
You know, maybe we need to do a series on, what did you say? Spinal hygiene, you know,
Sure, something like that. I
something
would
like
love
that.
that. But I just want everybody needs to be on board, or just promote it a different way, so the public could understand the importance of it. Um, Even your blood pressure. All right. So there's been studies, and I've seen it in my clinic. Patient has high blood pressure. After adjusting their neck, it could decrease as much as I've seen 19 millimeters of mercury, because your first
Wow.
6 vertebrae, okay, that have a hole in them right here, okay, and the vertebral arteries actually go inside that hole, which is connected to your spine, and then they connect from both sides and become the only blood source to your brain. So if
Oh my
if it's
gosh.
shifted left, right, side to side, that blood flow is not going to go to the brain the way it needs to. And that's why, like, the spine is like very important. The neck or cervical spine is crucial as well. And uh, I've seen patients before and after have positive or decreased blood pressure to a healthy range. Also, you're not sleeping well, because now you're not getting enough oxygen to the brain. You're constantly tired, breathing improperly, getting those dark spots under the eyes. So
I
yeah,
haven't been sleeping I kind of sleep like a little monkey. I have to make time to come and see you again because
I could adjust your neck seated just like that at the end.
okay.
Okay.
Well, we're gonna close out this episode, but I wanted to close it out on, I don't know if I remember the quote, but it was at Hippocrates.
Hippocrates.
Hippocrates. What was the quote that he said
I have
about?
to look it up word for word, but I believe it was, the doctor of the future will not be focused on medication, but the health of the spine.
Something
Something
like
like
that.
that. Benjamin
Yeah.
Franklin has one that's like amazing too. There's a bunch of it. And come on, that guy knew, Hippocrates
They
knew
knew
his
what's
stuff. So
up.
did Ben Franklin.
I mean, modern medicine is based on the
Yeah.
Hippocratic Oath.
Yes,
So he
exactly.
obviously knew
Knew
something, you
something.
guys.
So I do want to say one more thing with the CFR. I did get the opportunity to treat one patient who did come with multiple sclerosis. So within like 2 visits, we already started seeing her come in without her cane, walking properly. The moments like that happened,
Yeah.
but very far in between, and she was like loving it. Yeah, we did decompress her spine. I gave her like
Yeah.
everything
I
I
mean,
could
you
throw at her,
really
and I
gave her a
gave her a
new lease
time.
on life.
And what happened? She had a bunch of appearances, and she was filming the documentary. And what got her in was another patient who got it and loved it. And History Channel was following her to see how the diagnosis had affected her life, and what type of alternate medicine or holistic approaches she was doing to like try to find relief. I'm not
Yeah.
saying we cure MS, but we could definitely slow it down, or help the life, just
Lifespan. Yeah.
lifestyle. Okay.
I mean, I saw her receiving an award like a year or something after you had started treating her, and it was shocking.
Yeah.
It was like her old self again.
Yeah.
So,
But she did say, I did hear from the patient who referred her, was she's like meaning to be coming back again. And that's what happens. You start feeling good, and then it doesn't, you're not reminded of it. So you kind of put it on the back burner. But everyone's
Yep.
different. You get those patients who come religiously once a month, or like clockwork every 6 months. And then some people, until like it's completely taken over their life, they don't
It's
remember
me.
me.
I'm
And then
always
they
like,
come, get
I
an
can't
adjustment, and
feel
ask
my
you to be part of the
pinky,
podcast.
Raffi, Dr. Raffi.
Yeah, we'll treat your pinky, but we're gonna start with the neck. You're like, what do
Yeah.
you mean? What about
And then,
this?
so his clinic is so amazing, you guys. I just somehow end up in every room, and I'm hanging out with my Izzy Busy, or his sister has a amazing aesthetics
She's an
room.
esthetician,
She's
yes.
amazing. So I'll go and chat with her, and so it's a great place. It's very family friendly,
Yes.
and everybody's really fun.
Thank you.
So, if any of you guys are looking for an amazing way to kind of add this or introduce this into your life, I highly recommend Dr. Raffi, only because I've known him forever. I trust him, and I've personally been going to him forever. And I don't ever recommend someone or anything unless I personally have had experience with it. So I commend you because you are a very intuitive chiropractor. You really do see, past the MRI when you're working on me, or I've recommended you to some people who are very influential, who have gone through and spent a lot of time and money on other people, and they swear by you. They're actually in town.
Okay.
So
Appointments only.
yeah. So thank you so much
Not a problem.
for joining me
Of course, my
and
pleasure.
for really dedicating yourself to this practice and this modality, and sometimes at your own detriment because you've, have gotten hurt.
Yeah.
We can talk about that later.
Sure.
But yeah, thank you so much, Dr.
I just want to say
Raffi.
thank you for having me. Beautiful set, by the way. I actually want to get the number to where this thing was purchased. It's beautiful, but
It's
an
a
honor,
secret.
honestly.
Thank
Your energy is very unique, and it's always special when we're together. Just adjustments and talking life and health, and we could go on and on. But don't forget, we're ending this podcast with a neck adjustment.
Oh man! All right,
Let's
fine.
Go. All right. Am I allowed to just approach
okay.
the bench?
Is this
All right.
okay, guys? Is this okay? Okay. Oh my gosh.
And I'm okay to do this because you are a patient. I do have your health history.
Yes,
and
you do.
everything
You
like
do.
that. So
I can't believe you're making me do
this. She has a health
this.
history. She has a chart, so
Wait,
I know.
We can't see you though. Okay, can you do like that?
I'll go like this. It's fine. You ready? Just relax.
Wait, should we put the mic close so maybe we can hear the crack?
Hear it.
All right. Okay.
That's too close.
I'm kind of nervous.
We're just gonna take over here.
All right, go.
All right, just relax for me. Good. Let's just feel what's going on.
I'm shockingly relaxed.
Not too bad. Drop your shoulder, left shoulder. Good.
Oh, goodness.
Yes.
Goodness. Everybody needs to get cracked, you guys. Seriously.
All right. Actually, I have a gift for you.
Me too.
Thank you. But technically, we adjust the spine and we make a noise called crack. So, I'm technically a licensed crack dealer. So since you like my adjustments, you are a crack addict. So
I am.
Go rock that.
Oh, this is really nice.
H&M, baby. I got the good stuff.
Really?
Good stuff for my patients.
This is really, really soft. I'll be wearing this.
Rock it.
I can't wait to see the looks that I get.
I actually wore mine.
For those of you guys listening, it says licensed crack dealer. But by crack, we mean adjustments.
Well, there's a spine there to make sure there's no misunderstanding.
There's a spine there. So everybody knows we do not, in any circumstances, condone or promote any drug abuse.
But it just gets your attention.
Yes.
It's meant to be fun.
And I have a gift for you. I had already given Dr. Raffi one of my skin oils. And by the way, we'll get into this in another episode, but everything that I created with my company, Demk by Lily Hart, was for my father as he was going through his liver disease and issues. And this is still my old packaging, but he loved the oil. So I've actually put the skin oil, scalp oil.
Give it. Thank you.
My magic salve. And awesome. There's a rollie in there as well for you to keep in the car. And whenever, just to use it under your eyes.
I don't know if I'll do it in the car, but
you will.
For a guy to even, wow, this is beautiful.
Well, it's my old packaging. The new one is very, very nice.
But let me tell everyone listening, obviously as a guy, we don't do any of this face stuff. But I went to a seminar, the CFR, the advanced seminar, and it was in Washington. And within the first day, my entire face was so dry and itchy. And for 3 weeks, it didn't improve with whatever I tried putting on, even just lotions and stuff. And then I remember you gave me this, and within that night I wore it, within the next day, drastic improvement. So I actually wore it today morning just to see if my skin's glowing. So I thought it was amazing. So thank you very much.
Yeah, my pleasure. And I'm not a medical doctor or anything, but I've lived a holistic life my whole entire life, and every single thing that's in that product, you can actually consume it as well.
Wow.
My motto is if you can't eat it, you shouldn't put it on your face. And so that's the magic salve. It has restorative beef
That is
tallow,
huge.
castor oil, black seed oil, frankincense, colloidal silver. So everything in there is meant to heal, anti-inflammatory, antibacterial.
And I'm very sensitive. My skin is
Same.
very sensitive.
I break out.
And exactly, or rash.
Mhm.
And this actually
Awesome.
calmed me down, and you could feel like the effects
Yum.
started tingling and stuff, and my face is
Good.
not itching anymore.
Good.
Shut
The salve-
demkes.
So denk in Armenian means face and character. But the salve, you want to keep it
Yes,
refrigerated.
the salve.
All right.
Is
Well,
that cream.
that's it.
Thank
That's
you.
it.
Love it. Heart you.
Yay. Dr. Raffi, thank you so much for reminding us that chiropractics isn't an alternative, it's the foundational. Alignment is more than posture. It's energy, it's emotion, it's how you carry yourself in the world. When your body is in alignment, everything flows, your breath, your thoughts, and even your confidence. Because pain doesn't just live in our muscles, it lives in our story. And when you release the physical block, you free the emotional ones as well. So if today's episode opened your eyes to the deeper truth behind chiropractic care, hit subscribe, share it with someone who you know needs it, or better yet, book your first adjustment and feel the difference for yourself. That's the Heart of It with Lily. See you on the next one.
Yeah, I could be the lady. Thing on your mind. We could turn some to the Zuma Beach coast side, yeah.